Okay. Good afternoon, everyone, and welcome to our daily press conference. And it's good to be back from last week. But City Manager sends his greetings to everybody. He's doing well. He'll be out of quarantine over the weekend and back to work next week. So he's getting better. Also, before I forget, the next week's press conference will be December 24th at noon. That's December 24th at noon. And again, I just want to welcome everybody and just remind everybody the numbers aren't going in the right direction. In fact, they're pretty bad. So, in fact, today as we speak, there's over 74,000 people who have COVID-19 in the state of Massachusetts. And probably back a month or two ago, I think we announced 32,000 had it in one day. And we thought that was high back then. So I urge people to keep washing their hands, wear your mask, and socially distance wherever possible. And we get through this together as a team here in the city of Worcester. Give you some update on the cases. To date, there have been 12,785 confirmed positive cases in the city of Worcester. This is an increase of 1,390 over last week's report. And you remember last week we had 8 days in the count because of the, I think it was the snow day and the holiday. And so that's a big increase. And today there are 128 new cases. And we can do this, that's why we ask you to socially distance, be careful where you go. On Christmas and the holidays, when you celebrate Hanukkah, we ask you to keep your circle to your families, don't travel, and really think about your families and think about the healthcare workers who are on the front lines and who are tired. This is the 10th month they've been working nonstop, and they'll be working probably hard over the next several months. So, and more healthcare workers, we go over the stats, have increased their counts in COVID-19. So they're stretched, they're working overtime, and they're tired. So something to think about as you plan on your holiday, family holiday outings, and how you're going to handle that. And that's why we're begging you to not to travel, keep your circle to your family, and stay home. In the town of Shrewsbury has 1,254 cases. That's an increase of 228 cases from last week. Holden has 578, increase of 82. Grafton has 483 cumulative, increase of 80. And Leicester 496, that's an increase of 75. The hospital, St. Vincent's and UMass, total COVID positive patients right now are 238. That's an increase of 46. COVID-19 positive ICU patients, that's 56. That's an increase of 16 from last week. Total COVID deaths to date, that's 428. That's an increase of 20. And total COVID plus employees to date, that's 1,084. That's an increase of 150. Worcester deaths at 321. That's 8 over last week. Those are Worcester residents. We've lost 15 residents in the past 2 weeks. The DCU Center update, there are 31 positive patients currently at the DCU hospital. City cases, as of today, we have 38 active COVID cases among city employees that are isolating. 25 are in quarantine. 63 total employees are out at this time. The Worcester Fire Department has 9 positive, 13 are quarantined. Worcester Police Department has 10 positive, 3 are quarantined. City Hall has 11 positive, 6 are quarantined. Library has 1 positive, 2 are quarantined. DPW have 6 positive cases. Inspectional Services 1 positive case. And Health and Human Services has 1 quarantine case. Cases are broken down by age group. Here in the city of Worcester, as of December 16th, 19 and under has 1,572. That's 13% of the total. That's an increase of a whole 1% from last week. 20 to 29 is 2,176, an increase of 18%. 30 to 39 is 2,088, which is an increase of 17%. 40 to 49 is 1,840, that's 15%. And 50 to 59 is 1,879, that represents 15%. And 60 to 69 has 1,264, that represents 10%. And 70 and up is 1,579, that represents 13%. So you can see all these numbers distributed almost evenly across all age groups. So it affects everyone, not just the elderly here. Thanksgiving by the numbers. We spent the days and weeks leading up to Thanksgiving imploring folks to rethink how they celebrated the holiday. Now, weeks removed from Thanksgiving, we are seeing the evidence. Not everyone heeded the guidance. As the governor reported in his press conference on Tuesday, the numbers across the state have increased dramatically. The 7-day average case count on December 1st was 2,444. 8 days later, about 13 days after Thanksgiving, it's almost 4,800 cases per day. That's an increase of 96%. That's since Thanksgiving. That's what Dr. Hirsch talked about, the surge, and then we're right here in the middle of the surge right now. COVID-19 related deaths were up 84% since Thanksgiving, with 689 people dying of COVID since Thanksgiving. We are seeing the post-Thanksgiving spike in Worcester. In the weeks leading up to Thanksgiving, November 20th to 26th, the city's 7-day average case count was just above 92 per day. 3 weeks later, December 11th to December 17th, the average has almost doubled with a little more than 181 cases per day. As a result, we're now seeing a strain on our hospital systems. We are seeing more people hospitalized and more people in the ICUs. Now we are in the position of once more asking everyone to do what we've asked on Thanksgiving, for Christmas, Hanukkah, and Kwanzaa. We once again are urging people to rethink and reimagine their holiday celebrations. We have already seen greater restrictions as a result of the spike in cases. The state recently rolled back to step 1 of phase 3. The city of Boston and surrounding communities went to a step further this week to rolling back to phase 2, step 2. If we celebrate the upcoming holidays the way many folks celebrate Thanksgiving, we risk greater restrictions ahead. It is also allowing to note, this is an important note, that 42% of positive cases across the state are from household transmissions. So those are household transmissions, 42% of those positive cases. More than that, we risk many more people falling ill and many more people dying. The city mayors and I pled with all the residents of Worcester to take this seriously and do their part this holiday season to curb the spread of this deadly virus. You can find more out on how to celebrate the holidays safely this year by visiting www.mass.gov. And regarding the vaccines, as the governor said this week, we know help is on its way as hospitals around Massachusetts receive the first doses of the COVID-19 vaccine. The city is working extremely hard to make sure we are ready to distribute the vaccine when it is available. Our public health team is working closely with the community partners to ensure a plan will be in place, and we can get as many people as possible when that is done. We know it will take several months before the vaccine is distributed to everyone. Dr. Hirsch will talk about the plans for distribution, but we know our frontline workers, the real heroes who are risking their own health and safety to save our lives, will be first in line. This will include the medical personnel, police, fire, EMS, and others. Starting in February next year, the vaccine will be distributed among early education, K through 12, public health, and grocery stores, and others. It won't be until the spring in April 2021 that the vaccine is made available to the general public. In total, that makes it critical to continue following protocols, practicing the measures that can help prevent the spread of virus, and just never letting your guard down. The state's COVID enforcement intervention team has been conducting ongoing educational outreach throughout the state, including the city of Worcester, to increase the awareness of and the compliance with proper protocols. Last weekend, the team distributed 21,925 masks, 4,498 disinfectant wipes, 9,960 flyers in Spanish, Portuguese, and Vietnamese, and 59 business signs in Spanish. Virtual town hall meetings. On Thursday, Dr. Castillo and Dr. Hirsch led a virtual town hall meeting for daycare providers in charter, parochial, and private schools. Previously, the city has held town hall meetings for property managers, retail, and restaurant businesses. The town halls are being held to provide educational outreach and guidance on COVID regulations and protocols, including how to handle COVID-19 exposure and positive cases. Free testing. We encourage all folks to continue to take advantage of the free COVID-19 testing. Upcoming testing sponsored by UMass Memorial Care COVID-19 Equity Task Force and city managers of Worcester, in the city of Worcester at Mercantile Center will be on Monday and Tuesday next week at from 10:30 a.m. to 3 p.m. and also Monday and Tuesday on December 28th and 29th, the week after, again from 10:30 a.m. to 3 p.m. So that's Monday and Tuesdays for the next 2 weeks from 10:30 a.m. to 2 p.m. In closing, I just can't stress enough, we're just not talking about numbers of COVID-19 here. We're talking about real people. I know a few months back we had 297 roses that were put out representing the people that died. Hope is not to put out another 297 roses here in the city of Worcester. These are family members and loved ones. These are the people who won't be with us to celebrate Christmas, Kwanzaa, and Hanukkah. We are in the second wave, and it's getting a little bit scary. We are begging you to take it seriously. I know it's hard, especially with the holidays. We all want to be with our families. I know people who won't be traveling to see their children, their parents this Christmas because they simply can't take the risk. Again, I know it's hard and overwhelming, but at the same time, our hospitals are filling up and it's becoming overwhelming for them also. A few weeks ago, the city manager asked you to do it for the frontline workers in our local hospitals, and I am repeating that call today, and I'm also asking to do it for everyone here in the city of Worcester. There is hope on the horizon. There's a light at the end of the very long tunnel we've been walking through, so please do your part, and we're going to all emerge safe and healthily after this. We have a great team here in the city of Worcester. We're all in this together, and we'll get through this together over the next several months. Thank you. With that, I'd like to turn it over to Dr. Hirsch.
Thank you, Mayor Petty. First, I wanted to give a little acknowledgement to the very nice company here in town, Worcester Wares, that has some awesome online shopping opportunities, and I'm very grateful that someone thought of me to get me one of these hats, so thank you. I think the mayor kind of encompassed that whole Charles Dickens line, you know, it's the best of time and the worst of times. We have light at the end of the tunnel. I got to tell you that there were tears welling up in a lot of people's eyes when the first people at UMass Memorial and St. Vincent's were vaccinated yesterday. And we have this steady stream of people getting vaccinated every hour. It's a very organized approach. Both hospitals I checked in with on Wednesday, they have their prioritization schema very, very carefully laid out so that the people that are what they call most COVID-facing are getting the vaccinations first. So the emergency department nurses, the ICU nurses, the anesthesiology team, some of the different kind of surgery teams, the trauma team, the transplant teams are getting it first. And then at the same time, we'll be also taking care of the Worcester Emergency Medical Service folks at the UMass campus. Fire and police are right down the line a little bit from this first batch of vaccinations. And the hope is that between the Department of Public Health and the Emergency Operations Center and some of the volunteers that we have from the Stop the Spread program that Dr. Castillo's put together, we're working on an active program to try to vaccinate those folks. The mayor referenced that we have a very, very active conversation going on about emergency distribution sites that's been going on really since May. And early January, we'll be training almost 600 medical students in vaccination. The graduate nurses from the Graduate School of Nursing at UMass will help us get this army of vaccinators. We also have a great group of people volunteering from both the Worcester Medical Reserve Corps and the Worcester District Medical Society. So I think we're going to have a lot of boots on the ground to get the vaccine distributed once we are through that first phase of just in-hospital vaccinations. So that's the light at the end of the tunnel, the vaccine, but we have to get real about this until we've gotten everyone vaccinated, or at least 65% of the city vaccinated. We won't have herd immunity. And in that intervening time, there is still going to be a period where the virus is going to kind of have its way with us, unless we continue to do all of the things that we've been asking all along. The 3 W's, making sure that people do get a flu shot. It's not too late to get a flu shot. The flu season is still peaking, and really avoiding those family gatherings of more than your immediate bubble, because as you heard, 42% of the cases that are being reported out are coming from family spread, and that usually means an aunt, an uncle, a neighbor, somebody came into your bubble and you made the assumption that they didn't have the virus and they turned out to have the virus. Now, one of the things that I think was most touching about some of the information that I got this week was that there's a tremendous amount of stigma when a healthcare worker, for example, gets the virus, because they feel like they're spending all their time with double glasses, goggles, double masks, gowns, and they are, in their minds, being extra careful, and yet they're still getting the virus. So what does all that mean? So when I had my talk with the 2 health centers and the 2 medical centers on Wednesday, I asked Dr. George Abraham, who's a brilliant infectious disease specialist and chief of internal medicine at St. Vincent's, is the virus different now? Is there something different about it? So what I want to be very careful with how I phrase this. They've done DNA analysis on the viral samples that we're collecting now around the country, and they are different than the original samples that were collected in Wuhan. So the virus has changed. But what hasn't changed is the coding of the virus and the spike protein on the virus. That's really important, because that's what the vaccination is going to help us fight. Those spike proteins, the vaccine is going to make your body make antibodies to those spike proteins. So what we think has happened is that the virus has become more transmissible, but it probably is not packing maybe the same amount of punch to it. Either that, or we're just much better from what we learned in the first surge to knock it down quickly, because we have remdesivir, we have high-dose dexamethasone, steroids, we have some forms of monoclonal antibodies, we have convalescent plasma, we have different techniques of high-flow oxygen administration that can keep a patient from needing to be ventilated. And that's why, even though the numbers keep going up in the ICUs and up in the hospitals, we are not seeing the same level of death yet. I say yet because death is always a straggler with this. And it may be that just the sheer load of virus that is out there is going to see these numbers, these death numbers go up. And in the country, what we're seeing around the country, not here in Massachusetts as much, is huge numbers of death. And it's the number of people that were killed in 9/11 every day. So that is a staggering number. You end up at the end of the week having 20,000 people dead. So we are currently nationwide looking at 310,000 deaths. And it's a very sobering idea to think that that's going to continue until this vaccination has gotten widespread. So when I told all this today in our press prep conference that we do each time, and the city manager called into that, he was very encouraged by one thing that I said, which was people think they do everything right and they can still get the virus. And I think that the city manager and all of the office staff that he directly supervises have been extremely careful, and yet they still got the virus. So the two take-home messages from that is you still should do all the 3 Ws, but even if you do and then you get it, it wasn't for naught, because you still probably cut down on the spread of the virus because you were wearing your mask and doing your distancing. Unfortunately, the virus was able to get to you. So it's a very, very tough enemy. It is an enemy that I think we've figured out a lot of the innards of now. And finally, we're playing offense. We're not just back on our heels worrying about hiding in our rooms. I think that once we see a significant part of the population in this vaccination sequence that Mayor Petty referenced, we will start seeing the cases start to go down. But we've got probably 3 really tough months ahead. The first responders in this Tier 1 will get done by probably the end of January. We'll start doing Tier 2, which is the vulnerable populations, the folks that have comorbidities or are elderly, the communities of color, the educators in the K through 12 system, and the kids in those systems that are over 16, because the vaccine is not approved for anyone less than 16. These are all the people that will be done in Tier 2. Meanwhile, the pharmaceutical companies, Walgreens and CVS, have bought up many, many doses of this, and they're just waiting to start helping distribute to the general public. And the faster we get done with Tier 2, the faster that part will be. And because it's going to be done by these commercial entities, I think they're going to do it very, very efficiently, and they're going to learn from what we experience in these first 2 tiers. So I'm pretty sure that by June, we will have gotten all 3 tiers vaccinated, and you need about 6 weeks after the second vaccination in order to really have the immunity that we want everyone to have. So I'm still sticking to my prediction that by Thanksgiving of next year, we're going to be having very different and very much more fun holiday seasons, but there is going to be some pain on the way. And the only thing that we can ask, again, is the public to just do what they've done all through this pandemic, is to cooperate, collaborate with us, try to keep to your bubble, do your 3 Ws, make sure that you're washing your hands, keeping your distance, and wearing your masks. So the other thing I wanted to mention is that there are 224 UMass healthcare workers that are either in quarantine or in isolation, and 178 from the St. Vincent system. That's an enormous number of people. And I want to first wish them well and a speedy recovery, because they got this in the line of duty, and we want them to recover and hopefully get back online, but we want them to feel well. That's the most important thing. But we don't have a lot of reserve beyond what is already here in Worcester, because all the states are surging at the same time. So it's not like we can send out to Connecticut or send out to Ohio or send out to Florida. 48 out of the 50 states now are continuing to surge. So we've got to protect those healthcare workers, and that's what the city manager asked for 2 weeks ago, and what the mayor just asked for again. If you can think about every time you put that mask on, every time you follow the 3 Ws, that you're helping a healthcare worker avoid exposure, that would be awesome. If you think you were exposed, There are plenty of ways to get tested still. The free testing program is moving forward with Stop the Spread sites, mostly at the Mercantile Center right now. And I think that's going to go on right until the end of January. The dates are always posted on our website, www.worcesterma.gov. We also don't want people who are sick to come to work. And we're also imploring employers who, sometimes they want to keep their business going, they want to keep their restaurants going, they want to keep their retail outfits going. They may not be as understanding about the situation of a person that's just not feeling right. They could do so much good if they just reassured their employees that if they're not feeling well, don't come in. And there won't be repercussions and there won't be questions asked, but there will be testing that's available. And if those tests are positive, people have to tighten their belts and do without that worker, because that worker could be a super spreader if they came in to their place of work. So that's what we're urging our medical staff to do too, because there's an old expression, physician heal thyself. It doesn't only go for physicians, it goes for all medical providers. Feel like I got to get in, I'm taking care of people, I'm needed. And yes, you're needed, but if you're sick, you're also exposing others to that sickness. So we really are encouraging anyone in the medical community who's sick to also stay home or get themselves tested before they come back in. The model patient for all of this really is the city manager. I mean, he recognized he wasn't feeling well, he got himself tested, he went home, did all of the right things as far as isolation went, and he never missed a beat. He was on all the meetings that I can see, and I don't think he really spent an extra hour resting, but he sounded great today, and we were all laughing about how his great sense of humor was totally on display. So I'm very grateful that he was able to weather the storm so well. So the last thing I'll say, I always have a little history lesson. Today in 1966, if you were like I was, maybe 12 years old, watching CBS at night, this funky cartoon thing came on called How the Grinch Stole Christmas, and didn't know what it was about. I remember just reacting to the fact that Boris Karloff was doing the voice of the Grinch, and he scared the heck out of me watching those old Frankenstein movies. And it's still one of my favorite things. So if you have any time this weekend, see if you can pick it up on YouTube or someplace, because that whole concept of this kind of nasty, grumpy guy whose heart is 2 sizes too small, but when he sees what he does to this little Cindy Who in Whoville, it suddenly grows large. And I think that's how Worcester, which has always had an affinity for the heart as a symbol, has shown itself to be this whole pandemic. Worcester's heart has grown hugely large. We're still getting people donating food to the medical center and to the workers there. The people at the Family Health Center also are getting some of that benefit. They're exposed in a big way. 23 to 24% positivity rate at the Family Health Center, 38% positivity rate at the Edward M. Kennedy Center, and overall Worcester's positivity numbers this time were 30%. So you remember last week I was talking about how if you're in a group of 10 people in your house, it's likely that 2 people have COVID. Right now, if you have 3 people in your house, it's likely 1 has COVID. So I'm thinking that we all need a little Christmas, and the Grinch will tell you a little bit about how to celebrate. And I hope all of you stay safe, and we'll see you next week.
Just wondering how things are going at the DCU Center.
Yeah, so the DCU Center is working tirelessly. Dr. John Broach, who we've honored here as a medical hero, and the Worcester District Medical Society honored him as the Clinician of the Year, is doing an amazing job with his cohort of caretakers. They're at 31 now. They are probably going to find that over the weekend they're going to jump that up, maybe by a factor of almost 2. They've taken a lot of patients from Boston Medical Center, which is our sister safety net hospital in Boston. So not all of the patients are Worcester patients. And the throughput has been really good. There have been a number of patients that have started there, done their time as far as isolation goes, and have been able to find stable housing when they get out to be able to go back to their homes. We're doing a lot more in the way of directly admitting to the DCU Center. We didn't do that the last time. We had kind of almost always the patients first in the inpatient setting at St. Vincent's or at UMass, and then they were transferred there. But now if they get an evaluation in the emergency rooms of either of those 2 hospitals, Dr. Broach has a mechanism of directly admitting them there so they never clog up the system in the main hospital. So it's a real resource. It's just invaluable. I suspect, unfortunately, it's going to get busier and busier, and all those workers there need a round of applause. We also need more, and they're still recruiting for people. So anyone with, it doesn't have to be a super deep nursing or physician background. Sometimes you just need people that are going to act as kind of ward administrators, where they're taking notes on how the patients are doing. They can act as scribes as people do rounds. They'll record the statements that are made or the notes that need to be written. So don't hesitate to look on that site and see. And I think the compensation is pretty good. So you'll see that at UMassMemorial.org, www.umassmemorial.org. They have a site for DCU volunteers.
Dr. Hirsch, there's a lot of misinformation about the vaccine right now, and I know there are some populations that shouldn't be getting vaccinated. Can you talk about who those people are and what we can do to protect them?
So, Kim, that's a very good question. So far, the only absolute contraindication to getting a vaccination is if you have an active illness of any kind right then. But that would include COVID or flu or some other malady that you have like a chronic illness to. You shouldn't be getting it when that's flaring up, because your immune system may be a little bit off and it may not accept the information that the vaccine is going to transfer to you. The other group is the group that I would call the hyperallergenic people. So these are the people that carry around an EpiPen because they have a peanut allergy. If they get the little whiff of peanut, they will go into anaphylactic shock. Those are people that we're asking to wait because we want to see what the reactions are. So far, the reactions to the vaccine have been really mild. A little bit of swelling in the arm, maybe a little bit of low-grade fever at night the day after the administration, but that's about as much as we've heard. There hasn't been any contraindication so far to getting the vaccine during pregnancy, that has not been an issue. But if, again, anybody that wants to wait, that is okay. You can go to you won't go to the back of the line. You can go to a lower place in whatever tier you've been designated to, and just let the pregnancy proceed a little bit longer so that it's not in the first trimester. That's usually when problems will occur if you get a virus. And the other group that I think we have a little bit of concern about is just people that have had a probable COVID infection and they try to get it too soon. So, for example, for the city manager, the recommendation would be he not get his vaccination until he's probably about 2 to 4 weeks out from being done with his illness that he just went through.
See you the 24th at noon.